historically, we've trained health professionals in isolated silos. Doctors train with doctors, nurses train with nurses, and we assume that when they go out and practice, they'll figure out how to make it work together. In reality, that hasn't happened. And so we're trying to reimagine health professions training so that as a doctor becomes a doctor, as a nurse becomes a nurse, they do that in a relational context.
I think about life, and you can't just live it alone, right? And it's the same thing for a patient. They need a community of healthcare providers to help deliver the best care.
So REACH stands for Realizing Educational Advancement in Collaborative Health. One of the things we've tried to recognize in REACH is that there's teaching, there's learning, and sometimes you can do a lot of learning without teaching. If you create an environment, you create a set of problems that need to be solved, students will learn if you do that right. And so we've really moved, most of our curriculum looks very untraditional. Clinical Transformations takes place at our CAPE Center. And the way it works is a group of students, typically 20 to 30 students at a time, will come in. They'll go through the Team Steps curriculum, and that's an interactive workshop. Then they get grouped into teams. They're placed in a simulation environment, and they have no idea going in what their circumstance is going to be. They then are given a case, and then the case sort of unfolds in front of them. So there may be a standardized patient who is who their job is to figure out what they're experiencing. It might be a simulated person, a mannequin.
A while. Okay.
So they're going to get ready to call for 12. They're giving them some.
But they have to, as a team, work through that process, communicate about how they're going to problem solve, how they're going to determine what information they need, and how they're going to move forward.
I think knowing that other healthcare professional students are having the same experience does give me confidence in my colleagues' experience and empathy and understanding of where our patients are coming from. More than anything, the REACH program has re-emphasized the importance of interprofessional communication, just to make sure that each patient is getting the best possible care that they can.
I just can't help but smile when I think about the people involved in this, and this terrific group of faculty from all these different professions who have really come together and formed a common vision, committed to this work, and have made this come about. We really have an opportunity here in Colorado to provide leadership to the nation, to provide leadership for the state, and to really think about what it is we need to be doing in healthcare and how we move forward in society.